Hi everyone, today I'm here with Dr. Sharma, a cardiac surgeon who's been practicing in the field for over 10 years. So thank you, Dr. Sharma, for being part of this interview.
I appreciate your time. Thanks for coming by.
So could you briefly explain what cardiac surgery is and what types of cases you see?
Sure. So cardiac surgeons or heart surgeons obviously operate on the heart, and that means different things. The vast majority historically of what people used to do was bypass surgery, which is coronary surgery. When people have blockages in their heart, they get bypasses, and that would be the majority of operations or diseases that people would treat in cardiac surgery. It's changing with time as treatment strategies have changed and medications have been introduced. We're doing more and more structural type of cases like valves or aortic surgery, so replacing the aorta, whether it's the root, ascending, or the arch, or the descending, depending on your level of expertise and training. And as for the valves, well, all the valves are operated on. We rarely operate on the pulmonary valve. And we can do those through minimally invasive approaches. And now technology is pushing for endovascular approaches, and we participate in those cases also and have a significant role in those. So the field is changing very quickly, at least in the last 10 years.
Okay, and so is cardiac surgery a subspecialty of general surgery?
It's a very good question. It's also something that's been in evolution. I actually trained in Canada. I did my residency in Canada. I did a direct cardiac surgery training program, which is a 6-year program in Canada. And when I came to the U.S., I went to Stanford to do a fellowship in advanced cardiac surgery, aortic surgery, and heart failure. There is a movement towards that in certain programs in the U.S., Stanford being one of them. And so most of them are at least 7 years, a 7-year direct cardiac surgery, where you get exposed to other surgical specialties also, but there's a tremendous focus on the cardiovascular world. What's great about that is you can focus on endovascular therapies and the medical aspect of cardiology, which is all wonderful and necessary if you're going to be a solid heart surgeon. The traditional approach to training is to do general surgery and potentially do some research and then do 2 to 3 years of cardiac surgery fellowship afterwards. It's a longer route, and in present time may not necessarily be the most appropriate route, but that is a traditional route.
You were mentioning things like endovascular surgery. Is that a subspecialty of cardiovascular surgery?
Most heart surgeons now will be exposed to some endovascular valve therapy in their training. Some programs will be very heavy in that, and you'll get enough exposure, but I'd say the vast majority are probably still not sufficient to train a resident or a fellow to come through a traditional program and have confidence in that specialty. A lot of individuals go spend another year and get some advanced training in endovascular valves or aortic work. That's what I did. And I think that's very beneficial. But there are programs, like I said, that are dedicated to cardiac surgery, 6 or 7 years, and you will spend up to a year doing endovascular therapies in that training program. And obviously, you do something like that, you're ready to go when you're done.
So does everyone just practice like general cardiac surgery, or is there subspecialties of that?
There was a period of time when, as I alluded to before, when the coronary work started going away, when bypass surgery started decreasing the numbers, the jobs disappeared. They all dried up. And I'm talking about early 2000s to around 2010. That time frame, there were pretty much no jobs in cardiac surgery. They disappeared. And I think that's a direct reflection of all those bypass surgeries drying up, or a lot of them drying up due to coronary stents being placed by cardiologists. And so during that time frame, guys that were coming out like myself had to really market themselves by picking up other skill sets and getting specialty training like endovascular or complex aortic surgery or minimally invasive mitral or minimally invasive aortic, minimally invasive approaches to surgery. And so that's evolved in the last 10 years, where people are going out and doing heart failure and transplants. And that's always been there. But again, so people are coming out with a little bit more focus in their area they want to subspecialize in. And I think that the era of being a general cardiac surgeon is probably disappearing.
So could you walk us through a typical day in your life from when you come in to when you leave, and if that changes from like day to day?
I tend to be very busy clinically. I operate almost every day. And my day starts at 4 o'clock. I wake up at 4:30, and I go to the gym. That's what my day starts like, because that's the only time I can fit it in. And when I'm done working out, I come to the hospital, and I come directly, and I go around on my patients. and I check in on the patient that I'll be operating on before they go to sleep with anesthesia, just to make sure there's no issues. As they're getting that patient ready, I'm looking at my patients in the intensive care, making sure there's no active issues that need to be resolved before I go in and operate. And then around 7:40, 8 o'clock, I'm in the operating room. I don't do a lot of bypass surgery anymore. I'm doing a little bit more complex cases. And so my operations will be 6, 8, 10 hours in duration. And if it's a shorter operation, if I am doing a bypass surgery, I'll probably do 2 things that day. So I'll have a break in between where I'll go and eat something or go see a patient or 2, stabilize things in intensive care, and then start my second case. But typically I'm here a minimum of 12 hours a day. I have very long days. Mm-hmm. I don't get home before 7 o'clock on average. Mm-hmm. So my days are long. And when I'm really busy, I'm getting home at 10, 11 o'clock on a daily basis. So very long hours. This is not a lifestyle specialty at all.
Yeah.
Not at all. And so those are what my days are like.
How long are you sleeping a day?
It depends. During busy times, like over the holidays is a busy time typically for us. If I'm lucky, I'm getting 5 hours of sleep a day.
Mm-hmm. And then how do you stay functioning at like a high level? I feel like I'm a zombie after sleeping like less than like 6 even.
Yeah. So it catches up. The older you get, it gets harder too. There's a certain level of exposure you go through in training where you're subjected to very harsh conditions. Mm-hmm. That doesn't exist anymore. That's gone. They won't allow you to do that anymore. But for those of us that trained in a prehistoric time, I guess you want to call it, I do think that the benefit of that really pushes your limits and where you can find out what your limits really are, mm-hmm. where you're comfortable technically and your judgment-wise. And obviously age plays a part in terms of the older you get, the harder it becomes. But experience helps compensate for that. And so I'd say that the training really prepares you in terms of knowing what your limits are and how to compensate while you're in training so that when you are in the world by yourself, you can actually know yourself and know what you're capable of and then know how to adjust or recover. And so I'll need a day to sleep in. If I can sleep in for a day, I'm good to go for a week or 2. Mm-hmm. So that's how it typically works.
So I'm assuming with all the hours you have to work every day, you probably don't have time for like non-clinical or non-cardiac surgery related work. Is that true? Like research or doing like...
Sure.
Like policy work or things like that.
So I do have administrative work, and I try to fit it in throughout the day, whether it's running certain subspecialty programs or going out in program development. I was out last night. I got back at midnight, went out to mm-hmm. give a talk in terms of trying to push our program and try to create some growth. So that part of it is there. It's mm-hmm. just layered on top of our already busy day. Mm-hmm. And so it's a very busy lifestyle. I mean, it's very hard to the marketing piece of medicine is not well mm-hmm. taught in training mm-hmm. or in med school. But it's a very important component in our world. And my reality, it's a very important piece of my practice, the marketing piece. And so that's something that I have to do outside of my typical operating schedule. And there isn't a lot of time for it, but mm-hmm. You try to fit it in.
Why did you choose cardiac surgery in particular, like medicine and then cardiac surgery in particular, and then what motivates you to work as intensely as you do?
I started pretty young. Again, I went to a direct medical school program where I did a 5-year program. I was done when I was 23, and so when you're 19 years old, your perspective on life is very different than when you're 23 or 25 or 30. And so... But I did realize I wanted to help people, as all of us want to do in our field, and that is the priority. We want to make sure that be able to make a difference in people's lives, help them. And that's the most satisfying aspect of the job, and I was able to appreciate that going in. Being challenged academically, being challenged in terms of problem solving, we get that on a daily basis, and being challenged technically from a pure, whether you want to call it an art aspect or just the actual dexterity or the technical aspect of surgery. Mm-hmm. I enjoy that, and those are the things that I found alluring about my specialty.
And do you think there are certain personality types that are best for cardiac surgery? I'm sure like you have to be pretty stress tolerant.
Yeah, you have to be very stress tolerant. It's a good way of putting it. You have to be very calm under pressure because very bad things happen very quickly, and you should have to be able to deal with that and be able to lead the team. And make sure the team is calm and that no one's losing their mind. The other aspects of it that are important are you have to be very structured in your thought process, almost algorithmic like. And so you have to pre-plan in your head And before you do any of these procedures, you have to plan for best case scenario and plan for worst case scenario. And so you have to be very logical in your thought process so that you should have figured everything out before it happens. And so if something goes sideways, it should never really be unexpected. It should always be expected, and you should be able to deal with it. And so you have to have a thought process that works in that type of mindset. One thing that really prepped me the most for what I do on a day-to-day basis in the operating room is I played football as a kid growing up. And the interactions that I had with individuals on the team and the way you had to analyze the play and watch plays develop and react to it is something that permeates in what I do on a daily basis right now. And that's really the only thing I could think about growing up or any sort of educational experience that really still plays true when I'm working on a daily basis. You have to almost be predictive. You have to be able to see things developing, and so that you can react appropriately and to be successful in this field. You have to be extremely motivated, and you have to be willing to give up a lot of your personal time and personal life. And so there's a lot of sacrifices involved. And so my suggestion to students and residents is if there is something else that you like, you should probably do it. If this is something that you are passionate about and you love, well, this is right for you, because there's going to be tremendous sacrifice if you want to be good. If you want to really make an impact, there's this tremendous personal sacrifice, even in this current age and lifestyles and millennials and so on. It still holds true in this specialty, or else your patients are not going to do well.
So I was going to ask, what's the most challenging aspect of cardiac surgery? Is it all the stress and the hours that come with it?
I'd say the hardest part of cardiac surgery is everything outside of cardiac surgery because of the impact it puts on the rest of your life. The cardiac surgery part, you become so well trained, and so most heart surgeons are really well trained and they're very capable. I find that's the easiest part of my life. The actual surgeries and dealing with patients and interacting with patients and operating is what we're trained to do, and I find that to be the most calming part of my day. Everything else that takes a second seat to it, unfortunately, is a much more challenging aspect, and so it's very hard to balance your life. That is the hardest part of my job, is the balancing.
How do you establish a work-life balance and prevent burnout?
So we take a lot of time off. We take 12 weeks off a year. That's almost unheard of. It's obscene in a lot of other fields. But when we're working hard. And being in private practice gives me the opportunity to work my schedule the way I want. And our group takes 12 weeks off a year, not consecutively, obviously, but that allows us for that recovery, as you pointed out before. How do you recover from those days? It's that much time off. So we're either on or we're off. And when we're off, it gives us an opportunity to catch up with our family and catch up with our health and our sleep.
Any tips on making like a family work, or do you think that's kind of hard with being a heart surgeon?
You have to have a very, very understanding partner. To go through training with a family is very challenging. I only met my wife at the very end of my training. I only had kids as an attending surgeon. And it's already challenging as an attending. The training aspect was brutal during my time. It's changed a lot, like I said, because of all the laws, which is fine. It's great. It might be much more conducive to a family lifestyle now, but it's still very challenging. I don't know how I would have gotten through training if I was married. I don't think I would have been able to pull it off. Because it is already challenging on the relationships and your own personal sacrifices. And
you mentioned patient contact being one of the biggest motivators, and the impact you had on patients being one of the biggest motivators for you. What's the most rewarding aspect of cardiac surgery?
Yeah, it's the changing, is having that impact, being able to save somebody. When we do a lot of elective operations, I do a lot of elective operations and they're not in dire straits, but and so those are great operations. And you change their life. I mean, a lot of these patients initially are not feeling that great after the operation, but when you see them afterwards and you see how well they've done, that's very satisfying. The most satisfying are the ones that are going to die, and you change that, and so. It's a great feeling, obviously. And so I'd say that's probably the most satisfying aspect of it.
Are there any misconceptions about cardiac surgery?
A lot of the misconceptions are probably true. And so all the stereotypes, a lot of stereotypes are true. Very motivated, a lot of self-esteem, a lot of confidence. I think that sometimes there's some pathology in those individuals. I mean, in individuals, you do need to have those elements in your personality, I think, to be successful in cardiac surgery, because you can't be timid when you stop someone's heart and open it up. You just can't be timid. You're going to get a spectrum of individuals. That spectrum, you'll have very, very stereotypical, intense people that you'll see portrayed on TV or whatever it may be, and then you'll get some people that may be more on the timid side or nicer. And so you'll see that in all specialties. But the stereotypes do hold true, I think, and that heart surgeons tend to be very confident or maybe a bit too much self-esteem and tend to be very intense and expect that same level of intensity from everyone around them, and sometimes have difficulty understanding why other people aren't as intense as them. But I do think it's changing. I do think that the traditional personalities that went into cardiac surgery are not necessarily going into medicine or into heart surgery. And so I do think that a newer generation has a much more holistic approach to life. And so it's probably good for, I'm starting to get older now too, it's probably good for me too. And so have a little bit more impact on our work-life balance and so on.
What tips would you give medical students to match into a good general surgery and then cardiac surgery fellowship or like a direct program?
Well, you have to show interest and you have to show a lot of motivation. I mean, you asked me, who's this for? This is not for, someone told me this when I was in the exact same position as you, trying to figure out what I wanted to do. Plan on going to the ball game every weekend, you're not going to be a heart surgeon. It's just not going to happen. And so you're right off the bat, you know that there's going to be a significant sacrifice you're going to make from a personal standpoint. And there are some people that are extremely successful on both ends of things, and I'm still working towards finding that. But the tips in terms of trying to get into a program would be you have to show incredible work ethic. And commitment to your patients, unrelenting commitment to your patients, and unfortunately before the rest of your family life and so on, your patient commitment has to be that significant, because if you're going to train someone to take care of your patients or operate on your patients, you want to make sure they have that same level of commitment as you do. And so I think that is becoming a more important thing that programs are definitely looking for as society changes and the generations change and the priorities change. It's still something that a lot of surgical programs will. I mean, if there was one attribute that would be, or one thing that you're going to show, you better be very committed.
So show commitment, and then, of course, things like good letters of recommendation are important. Do we need research in that particular field?
For highly competitive programs, it's ideal. And or electives or selectives, whatever you call them in your program, in those facilities, that was very beneficial for me. That helped me get in an opportunity to perform and show them what you're capable of doing, or at least in a program that will be respected, if a sister program or whatever it may be, so that letters of recommendation out of that program will help.
Okay, and so you mentioned you're working in a private practice setting. What employment types are available? Could you do like locums work or like part-time?
There are locums jobs that exist. They are very different. You're going to be working one weekend whenever 1 week you want, or even a weekend. Those are not real jobs for people that are coming out of training, because you're not going to get comfortable. And because of all the restrictions in terms of training that have been put in over the last 10, 15 years, work hours, etc. When you're coming out of training now, most heart surgeons aren't ready to go in terms of being truly independent. And if you're going to be a locums, you have to have some degree of experience and independence. And so my recommendation is that you want to be in a facility that has a lot of experience and seasoned surgeons, so that they can help build your career.
So you mentioned there's opportunity for private practice. Yeah. Could you be like an independent surgeon, or not really?
It's becoming very obsolete. Healthcare is changing very quickly in this country, and the era of a true independent private surgeon is going away. It exists in smaller towns where there's just one heart surgeon and they can pull it off, but even that's going away. Most people are hospital or foundation employed, we're part of a medical group. We're part of a medical group. I say we're private practice, but we're actually part of a medical group, a large medical group. And we're hospital affiliated, but it's still not an academic facility, and so I consider it private practice.
What other changes in medicine do you see in the next few decades?
Well, for surgery, everything is going to be less invasive. I mean, for us, endovascular. And so those are things that are quickly changing, and a lot of energy financially and effort are being placed in trying to develop newer technologies. So it's a very exciting time. A lot of traditional heart surgeons say or maybe fearful of the changes, but it's nice to see the field improving and having less impact, or at least less bad impact to the patients, in the sense that the surgeries are less invasive and they have better outcomes. But for medicine as a whole, I think that technology is really only in its infancy in medicine, especially electronic technology or electronic medical records and how we interact with patients. I think that is going to change completely as technology really introduces itself into our field. I think that the model of how we deal with patients and how we interact with patients is going to completely change for the better.
And moving on to finances, how well are cardiac surgeons compensated generally, and how is that relative to other physicians? I'm sure it's probably on the upper end.
It's definitely upper end. There aren't that many other subspecialties that are probably earning as much. We're talking about in the same ballpark as neurosurgeons and transplant surgeons. Those are the specialties that take years of training, and those are the specialties that you're getting home at 10 o'clock at night, right? And so you can work at the fast food restaurant all day and you'll make a lot more money too, right? And so I do think that most of the specialties that are potentially the highest earning specialties are usually the ones that either A, require tremendous effort, and our specialty is one of them. Other specialties offer business opportunities, and you don't have to put in the effort that we do, and I think that those are interesting, but we are definitely one of the higher compensated specialties.
For cardiac surgeons, are there certain ways of practice that would net more income for people who are more trying to achieve those things?
Well, we talked about the marketing aspect before. It's very important. This is unfortunately a business, and your product is only going to do well if it's a good product. Your product is only going to do well if a customer has a good interaction. You're going to go to Target if they treat you badly at Walmart. And so I think that business end of medicine is not well taught. You'd think that a lot of it is intuitive. It's actually not. We can see that on day-to-day practice, interacting with other people. But all those interactions on referring doctors, patients, is becoming more of an issue now, or at least people are bringing it to physicians' attention. Compensations being tied into surveys, compensations being tied into quality and outcomes, and the internet is becoming a bigger part of our reality in the sense of online reviews and so on. People read this stuff, and that impacts your business, or impacts your clinical practice, and it impacts your success both clinically and financially. And so those aspects of any clinical practice are important. The business aspect of things. You can work hard, just do more cases. And the only way you're going to do more cases is if you deliver a good product.
Focus on doing well by your patients, basically.
Yep. Treat your patients like your family and do your best, and usually it takes care of itself.
How do you, with all the advances in medicine, how do you stay on top of your field?
Oh, it's a good question. We're talking about subspecializing. Even the era of the general cardiac surgeon is disappearing. You have to be a subspecialist so that you're on the cutting edge and so that you can continue to progress. If you try to keep your hands in every bucket, you usually are not going to keep up with the newer technologies, or keep up with the field as it's evolving. And so you have to really have a baby and let it grow and work on that baby. It's harder to have multiple babies.
So like one thing I was thinking of is maybe family medicine, but family medicine seems like you're never able to even scratch the surface of a lot of different pathologies.
But you deliver healthcare and a lot of good to a lot of people, right? And you need great family physicians that help direct care and pick up pathology to start that process to really treat the patient. So it's a very different mindset, and it's a very different personality that is successful at that primary care level.
And just personally, I wanted to ask a question. You mentioned earlier that being stress tolerant and calm under pressure is like one of the attributes of a cardiac surgeon. I feel like that's the opposite of what I am. And do you feel that's something that is innate or something that you developed, or maybe both?
It's always a combination. And there's some people that have there's a lot of heart surgeons that don't have that personality characteristic at all, and they'll never even developed it, and they're still able to do decent. In my eyes, I think it's those skill sets are very important to be really successful, and the more exposure you get, the more calm you develop, or more calmness you develop. Because you're able to see more and more situations, so you don't get too worked up with it. And so that's why it's very important you go through a good training program. You go through a good training program with very good mentors. They will mentor you to develop that skill set. I do think it's trainable, or you can learn it, but I do think that the vast majority of people don't necessarily learn it, they have it. It's innate.
Yeah, because I remember talking to a brain surgeon. He said that based on his reading, it seems like it's more innate than...
Yeah, it's very funny. You go into you talk to neurosurgeons, and they're all very similar. You talk to heart surgeons, they all tend to be very similar too. And I don't know if that's just something that people like to gravitate to people that they're like, and that's why they choose those specialties, or those personalities are much more successful in those specialties. And again, it's probably a combination of both things. But it's uncanny how similar, or I guess that's stereotyping, how similar heart surgeons are, and how similar orthopedic surgeons are, and how similar family medicine doctors are. And so I do think that there are skill sets that lend themselves to different specialties. And some of them are innate, and some of them you can learn.
I guess that must be good for making friends then, huh? In your department?
No? Heart surgeons are very intense. Heart surgeons are very intense people.
Okay, so if you could go back, would you choose the same career path, or would you change anything?
I was very fortunate. I finished my training when I was 29, and so that career path required a lot of sacrifice in terms of getting to that point. I can't see myself doing anything else, and now I've been in medicine for an extended period of time, over 20 years. But there was nothing really that piqued my interest as much as this did. And I do think it's very important when you're going through clinical rotations to really keep an open mind to everything. You'll be shocked at what you may potentially like or what you may actually be good at. And it's nice if both of those things align. And so you have to have a very open mindset, and you want to learn as much as you can during those rotations. Not just the specialty, but of yourself. I don't think I would change anything differently. I don't know if I would have been able to do it if I was older. I don't think I could have achieved what I achieved if I was older. That might have been... If I was older, I don't know if I would have been able to pull it off. I was very lucky. I was young at that time.
And last question, what tips would you give us to become good doctors?
Well, I already said it. Treat your patients like you would your own family. Let that drive your decision making. If you're making decisions based on your lifestyle, it's going to impact your outcomes. I do think that one of the most important things you can do is when you look at a patient, you should really treat them like your family, and it helps make your decisions a lot easier. If you're treating everyone the same way, patients recognize it, they appreciate it, and your outcomes will be better.
Well, thank you, Dr. Sharma, for being a part of this interview.
No worries.
Thank you guys for watching. If you have any questions, leave it down in the description box, and I can ask Dr. Sharma and get back to you guys. Thank you again for watching. Have a great rest of your day.